Hello, everyone. Welcome back to the Physio Almanac. The topic for today is sternal precautions post coronary artery bypass grafting. But let's talk about why does someone have to undergo a coronary artery bypass grafting in the first place? So, when the coronary arteries, the arteries which supply blood to your heart, the right and the left coronary arteries, when they become narrowed or blocked by a plague, atherosclerosis we are talking about, which is a fatty substance which can be caused by multiple reasons, and there are many risk factors that can lead to the development of atherosclerosis. It slows down or it restricts the blood flowing to the heart muscles, which can present as angina or myocardial infarction, which we commonly know as. So, if you look at this picture, a normal artery would have unrestricted flow of blood. So, even when the patient is exercising or doing any stressful activities, he does not have any issues. But in certain cases, the vessels can become narrowed or blocked as a result of the fatty substance, which can affect the amount of blood which is flowing to the heart muscle, presenting as angina or myocardial infarction. So the surgeons do this surgery, which is known as coronary artery bypass grafting or cabbage, which bypasses the blood or bypasses the root and the blocked root and allows proper flow of blood into the heart. It helps the patient relieve their symptoms and also improves their quality of life. The commonly used graft sites are the internal mammary arteries. The arteries which are commonly used are the internal mammary arteries or the radial arteries, or at times the greater saphenous vein. So, when you would go and see a patient, they would, if the graft site is the greater saphenous vein, they would have additional dressing other than the one on their chest. They would have additional dressing on their leg. If the radial artery has been taken, they would have additional dressing on their forearm. And based on the number of grafts that have been taken for the surgery would be known as a double bypass grafting or a triple bypass grafting surgery, and so on. So, how is the surgery done? The surgery is done by uh, the median sternotomy incision. So, it's a incision down, straight down on the sternum, and retractors are used to open up the chest or retract the sternum and the muscles, and the surgeons are able to access the heart. So, after the surgery is completed, the surgeon uses wires and cords to hold the sternum in place. And as a result, the patients are given some instructions or some activities or restrictions are imposed to promote normal healing of the sternum. Now, these restrictions or these activities that the patients are asked to avoid, this list is known as sternal precautions. And these are advised to prevent complications such as sternal instability, infections, wound dehiscence. Even though these complications are rare, but the mortality and the morbidity resulting from um, these complications can lead to further complications, and it affects the normal healing of the sternum, and hence it can affect the recovery time of the patients. So that's why these precautions are given. Now, there were some sternal precautions that were given traditionally, which were very strict, which were like no pushing or pulling through the arms, no reaching behind the back, no lifting more than 4.5 kilos. And they usually vary from surgeon to surgeon and hospital to hospital. But what was happening as a result of those sternal precautions, the patient started to have fear of movement, or it lead to disuse atrophy, because the patient used to be so scared to move, and it used to affect the patients coming out of the bed, for instance, because they were not allowed to push with their arms, or affecting their transfers. And if you can see at these pictures here, these were some of the restrictions that were imposed. So the patients were not able to reach at the back to close their bra or wash their hair, and transfers were getting affected. So researchers suggested some alternate precautions. So one advice in 2011 that was suggested is, instead of imposing the same restrictions for all the patients, how about the restrictions are modified according to their patient presentation? In 2016, um, Adams et al. Suggested recommendations which are known as keep your move in the tube. And these precautions are commonly being used across many hospitals in Australia. And what it suggests is it classifies movements or restriction based on whether the patient is performing a loaded arm movement or an unloaded arm movement. So, unloaded arm movement is, um, for example, washing your hair. So, patients can perform those activities as long as it's within a pain free range of motion. And loaded arm movement, for example, using your arms to come out of the bed or using your arms to come out of the chair, they can be done as long as the arms, the upper arms specifically, remain close to the body. So, what they suggested is, if you look at this picture, the patient were advised to imagine that there is an imaginary tube around their trunk. So, what you have to do is you have to keep your upper arm close to your body. So, the shoulders remain adducted close to the body. And what we are trying to do is we are trying to minimize the movement of the humerus, which is preventing the lateral pull on the sternum, and hence it's helpful for the patient by avoiding any excessive load or any excessive stress to the sternum. So, if you look at this picture, for example, if the patient has to come out of the bed, he is asked to bend one of the leg, turn to the side, and so the patient is on lying on his right side, and he can use his left arm to sit up at the side of the bed. So there is a video that you can look at later in the slide. I've put the reference in there, which will help you to understand this better. So the patient can use a bit of force through their arm, specifically the left arm, which is close to their body, and can sit up. Now, if they have to push their wheelchair, which is a loaded arm movement, their upper arm should be close to their body. But if you look at the second diagram, they are reaching their arms overhead. So it is a non-load bearing activity. It is for example, washing their hair, personal hygiene. They are allowed to reach out of the tube, but it is dependent on their pain tolerance. So if you are performing activities that are going to be using your arms to push through, you keep your arms close to your body. If it is activities that do not require force through your arms, such as washing your hair, unloaded arm movements can be done depending on the patient's pain levels. So, why were these modified sternal precautions introduced? Because what was happening is, as a result of the restrictive traditional precautions, the patients were spending more time in the hospital. because they were not able to push through their arms. So their transfers and mobility was getting very affected because they required assistance from their nursing staff or the family members. And it was becoming a deterrent for their patients discharged to home, and especially for patients who were living by themselves. So when the keep your move in the tube restrictions were introduced, it helped the patient to use their arms for mobility and transfers more efficiently, and hence they were able to get discharged to their home. Right? So the patients were able to resume their activities as long as they were not having pain when they were doing these activities. It was facilitating, and it is actually facilitating early discharge, earlier recovery of the patients, and they can resume their daily activities at a quicker pace as compared to the traditional precautions. So there's this video that I would highly recommend you to watch. But these modified precautions are being very, very helpful in recovery of the patient. So if the question in your um, treatment or is, how do I come out of the bed, you advise the patient you keep your upper arms close to your body, and you can push gently but with not lot of force, not causing any pain on your sternum, and you can use your arms to push through, or maybe use your walker, or for sit to stand transfers. Keep your upper arm close to your body, and when you are washing your hair, or um, maybe trying to open the door or any activities, make sure to be guided by pain. So unloaded activities, make sure to be guided by pain, and loaded activities, make sure to keep your upper arms close to your body. That's the advice that you would give to the patient who has just had a coronary artery bypass grafting. So this is an additional resource which you can refer, and these are the references. Thank you for joining in today. I hope this was helpful, and I'll see you all in the next one. Thank you.